Joining us now is Dr. Tom Frieden, former CDC director and CEO of Resolve to Save Lives. Dr. Frieden, thanks for joining us. It's good to see you again.
Nice to see you.
What is white lung syndrome that we're seeing out of Ohio, and is there any connection to the respiratory outbreak in the packed hospitals we're seeing in China?
I think what we're seeing in the U.S. and around the world is some people call it triple-demic. Nothing new, but in force, flu, COVID, RSV, and mycoplasma, 4 different infections that are affecting us because for a year or two, people weren't really out and about much. And we created something that's sometimes called an immunity gap. Many people didn't get infections over the last couple of years. Actually, in 2020, 2021, there was essentially no flu season. So it's now come roaring back. The good news is that there's a lot you can do about it. Vaccines for influenza, COVID, and if you're over 65 or at risk, RSV are highly effective and are safe. I've made sure that I get them, my family gets them, and I recommend them to patients as well. At the same time, it's important to investigate any cluster of disease. Mycoplasma is a little unusual. Although we don't have a vaccine for it, there's very effective treatment. It's a bacterial infection. It causes what's sometimes called walking pneumonia, which the patient actually looks pretty healthy, but the x-ray doesn't look so healthy. But it's very easy to treat, but it does require going to a hospital, getting diagnosed, or a doctor getting diagnosed, and also getting treated well. One of the things we're seeing in places around the world is where the family doctor system, where primary care doctors aren't trusted, people don't go to them, hospitals get overwhelmed with things that really can be treated on an outpatient basis at your local doctor's office.
I appreciate that. And, you know, we were looking at those images coming out of China. They are worrisome to so many. The CDC saying that the outbreak in China is no cause for concern, that it is not suspected to be a new or novel respiratory virus. Do you agree with their analysis? No cause for concern?
Well, absolutely everything we've seen doesn't suggest that it's a new or novel virus like COVID-19 was new a few years ago. But of course, when a lot of kids are getting sick, of course it's of concern. And that's why it's important that we vaccinate against influenza, vaccinate against COVID, vaccinate against RSV. That's a new vaccine. It's very effective for people over 65 or at risk. There's a lot that we can do to make sure that if people do get sick, that they get cared for well, and that we do everything possible to reduce the level of illness so that not only people are healthier, but also our economy is protected and continue to progress.
Yeah, and Dr. Frieden, I know you mentioned trust earlier. I do want to point out trust in public health so damaged in the pandemic. We know one poll found nearly a quarter of Americans have little to no confidence in CDC recommendations. How concerning is this? How concerned are you that when it comes to the CDC making this recent statement or others going forward, that the CDC just doesn't have public confidence in the way it used to?
I am concerned, and some of this comes from information that people see that may be confusing or inaccurate on the internet and elsewhere. That's why it's really important that we in public health are very clear. We tell you what we know, when we know it, how we know it, what we're doing to try to find out more. Whatever we know, you should know. And that's what we have a commitment to in public health. What we know is that flu, COVID, RSV, mycoplasma are known infections. They're spreading. They are of concern. They're preventable, or in the case of mycoplasma, treatable. And every day, as we learn more, we share that with the public.
And 5 senators, as we were just seeing in that report by Elizabeth Pran, are calling on the president to impose a travel ban on China. Do you think that that would be the right move?
No, it wouldn't be. Let's be really clear. Restricting travel may buy you a few days, maybe a week, to be better prepared. If there were a new pathogen that had emerged, nothing we've seen suggests there's a new pathogen that's emerged. And what are we doing now to get better prepared? What would that look like? That would look like increasing our vaccination rate, which is horrifically low in seniors and in nursing homes. Improving flu vaccination, making sure that people benefit from this great new vaccine for RSV that can prevent what is a very serious infection. This is what we need to be doing, improving our own preparedness as a country, strengthening our public health and primary healthcare systems so that we can be healthier, more productive, and less at risk if there is a new infection that comes from anywhere in the world.
All right. Former CDC Director Dr. Tom Frieden, appreciate your time. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.